I grew up in a small farming community in Louisiana that had a hospital that had about 30 beds, and probably maximum capacity was 8 patients that I ever saw at one time. But I was fortunate at that early age to volunteer at that little facility, and I learned a lot. There were a lot of nurses who kind of took me under their wing and taught me things. It was also the first time that I ever got to see and interact with male nurses, and they really got me thinking about nursing as a career. I have always had an educator role since my time as an ER nurse in the early 1990s. I was always involved in things such as precepting, being an instructor in ACLS or PALS, and I really fell in love with that role because I love when you see that light go off in someone's eyes that they've, I got it. What you just told me helped me get that concept.
I first met Myron when I was a student here at the school. I was going through the nurse anesthesia program, and it was the spring of 2010, and he was actually new faculty. So myself and my classmates had already been in the school for quite a while, so we felt like you feel like you'd already established your domain, and here comes this new person. And as the year went along, and as we were exposed to more of his lectures, I realized what a gifted teacher he was. I saw that not only did he have talent, but he had a desire. You can be good at something if you have talent, and that can only get you so far, but the desire is what really matters. And I saw that he enjoyed it. And his lectures were phenomenal. We all felt he really kind of cemented everything for us, kind of put it all together. We would say he's going to get to preaching here. Here he goes. He's going to get to talking here. And even if it was something as simple as like a cardiovascular lecture, which doesn't sound particularly, I don't want to say interesting, but we've heard it a million times. Because he was so good at it, at the end we felt like, not necessarily it was like the first time we'd heard it, but it was just a different way of hearing it.
He's very dynamic in the classroom. We have whiteboards on all sides of the room, and he travels around the room writing on drawing all these pictures, and they frantically try to copy his pictures. He really fosters that in them, this sense of our work is very important, this knowledge is very important, but in a fun way.
I use a combination of teaching methods. There's no one way of doing things. What I do like to incorporate in teaching are stories, humor, connections to the real world. I have been engaged always in an education role and a practice role. I currently practice at LBJ Hospital. Clinical practice both informs and enlightens teaching. And that enlightenment of teaching that you get from your practice keeps you current and instills in your students that you know what you're talking about because you do this. And it allows me to interweave those clinical stories to help solidify concepts.
He has a way of not giving you the answer, but making you see it, making you realize what the answer is. And I think that's the hallmark of a really good teacher.
Myron is a true leader. He's not a micromanager. He gives his staff the skills and tasks of what he needs accomplished, and he lets you bring to the table your own way of doing things, and he'll offer guidance as needed. He's not a very overpowering manager.
And I had the good fortune of Myron hiring me on here. And what I saw as an assistant professor just really was what I saw as a student. He cares about his students, and more importantly, he cares about what he turns out as a student in terms of, are they going to be good practitioners? Are they concerned about the patient? And so he really fosters not only knowledge, but also compassion towards the patient.
The number one thing that I've learned from Myron is to always consider the unintended consequences of everything that we implement or decide, policy-wise, teaching-wise, and I really have taken that to every part of my life, not just here at the university.
I have the greatest faculty in the world. They are all hard workers. They are all diligent. They are well prepared. They give it their all. Our goal is to get that next generation of nurse anesthetists who are going to sustain the vigor and enthusiasm of the nurse anesthesia profession. My wife has stood by me through thick and thin as I was going through nurse anesthesia school, starting as faculty. She's been unwavering in her support. My daughter is always wanting to help me with something if I'm doing anything for school. She's always like, "Daddy, what are you doing? Can you show me what you're doing?" So they have both been very unwavering in their support and their love.
Congratulations, MYRON, from all of us at the Nurse Anesthesia Division at the UT Health Houston Cizik School of Nursing. We're so proud of you.
I just want to say congratulations to an award well earned. I've known you as your student, as your advisee, and now as a colleague. And I couldn't imagine anybody else bringing me along in the manner that you have. And thank you very much.